Paul David Wellstone, Jr. is the son of the late Senator Paul Wellstone. He is the co-chair of the Wellstone Action Advisory Board and contributes to advocacy efforts on behalf of mental health and domestic violence. He is the co-founder of Wellstone Action, a national center for training and leadership development, as well as the founding partner of Family Place Home Builders, a business dedicated to building affordable housing. David graduated from Hamline University in 1987. It's great to have you with us, David.
Mr. Chairman and members of the subcommittee, I want to thank you for the opportunity to speak this afternoon on legislation that addresses an extremely critical health issue facing millions of Americans, parity for the treatment of mental illness and addiction. This legislation is very close to my heart, and I want to thank Congressman Kennedy and Congressman Ramstad, my good friend who is not here, for honoring my father's legacy and naming this bill. My brother and I founded Wellstone Action to carry on my father's work, and through the Wellstone Action organization, thousands of people are being trained each year to develop grassroots skills in organizing and leadership. But nothing represents my father's passion and commitment more than his work to end the discrimination against those who suffer from mental illness and addiction. Please accept the gratitude of my family and that of Wellstone Action for this tribute to my father. I also want to thank Mrs. Carter for her many years of leadership on this issue and many others related to mental illness. You and my father often worked together, and he was always very grateful for your support and leadership. I've been coming to Washington frequently to speak in support of this legislation, but my father started this work years ago. Many of you are familiar with the milestones in the long history of the fight for parity, the 1996 federal law, the 1999 executive order that gave federal employees mental health and addiction parity benefits, the many successes of grassroots advocates to strengthen state parity laws, the times that Congress came very close to passing the expansion of the federal law, and the endorsement by President Bush in 2002. For my father, these milestones were very personal. His dedication began when he witnessed the terrible conditions in psychiatric institutions where his own brother, my uncle, was hospitalized in the 1950s. These conditions and the eventual catastrophic financial toll endured by my grandparents inspired my father to do everything he could to make things right for those in similar circumstances. The legislation that my father and Senator Domenici passed in 1996 was groundbreaking, for it established in law an important first principle of parity, that those with mental illness should not be discriminated against in insurance coverage. But my father knew that that was not enough, and he was never satisfied with the compromises that were made at that time. That's why he immediately began the fight for a more comprehensive federal parity law, one that would include addiction parity and that would close the loopholes that the insurance industry had immediately started using to reduce benefits. His efforts over the years came close to success several times, including once during his last term in office. But despite promises then and promises made after he died, the federal parity law has not yet passed. This law is long overdue, and that's why we're here today. The bill has been negotiated for years, and important and fair compromises and protections are in place in the proposed House legislation that is the subject of this hearing today. It is time to move forward, for while we wait, people are suffering and dying from lack of care. The House bill has critically important provisions that will improve care, and I want to take just a couple of minutes to mention them. The House legislation recognizes the essential role of scientific and medical knowledge in ensuring high-quality diagnosis and treatment by requiring the widely accepted DSM as the basis for coverage. Without this requirement, insurers and employers could decide, without the benefit of science or medical expertise, which mental illness or addiction diagnosis should be covered. I applaud the efforts of the House sponsors to stand firm in its effort to be clear about this requirement. It is important to close this potential loophole, one that could allow discrimination by diagnosis, something that has no place anywhere, but least of all in a parity bill. The House bill has important protections for state parity laws. In contrast to a current effort to preempt stronger state parity laws, my father advocated for the inclusion of protective language to prevent this preemption in bills he sponsored. In keeping with the principle of protecting state law, the House legislation includes important language, and I urge you to maintain those protections. We know from numerous reports, including one today, that the cost for parity is low, and we're going to hear that. Once cost is set aside as the reason for denial of parity, what is left is stigma and discrimination. Fortunately for our country, there are courageous people who fight against this discrimination, People like my friend Kitty Weston, who lost her daughter Anna to an eating disorder. Kitty's family faced this kind of discrimination but went on to help change the healthcare system in Minnesota and is now helping change the federal law. My father fought hard for those who had no voice, and he had a strong personal commitment to help those with mental illness and addiction. Congressional members honored his memory by promising to name the Parity bill after my dad, and for that I'm grateful. But I do know the kind of man my father was and the kind of Parity bill he would have wanted finally passed into law. The protections for patients that have been included in the House bill, such as protection for stronger state laws, full diagnosis coverage, and transparency of medical necessity, are essential to the kind of strong law that he fought for, and I urge you to include them in your final markup and passage. In the end, I am involved because this is the right thing to do. I want to do my part. This Congress has the opportunity to play a major role in history, and I urge you to do your part to finally enact a strong parity law. Thank you for your courage and your commitment to do the right thing, and know that I'll be there by your side with your efforts to pass this legislation. Thank you very much.